Welcome to Virtue Podcast, powered by Azkka Pharmaceuticals, India's first company to bring evidence-based flat pricing in medicine. Virtue Podcast brings in renowned healthcare experts as we explore the path to healthier living, where science meets virtuosity. Tune in to YouTube, Instagram, Facebook, and Spotify as we welcome our virtuous guest. Don't forget to subscribe, hit the bell icon for the latest updates, and leave your comments.
India today is home to millions living with diabetes, and many don't even know what type they have or what it really means. As the famous saying goes, the biggest risk is the risk you don't know that you have it.
Generally, we call it as there are four different types or classification of diabetes. Number one is type 1 diabetes, which generally occurs in children or adolescents or age less than 35 years. It is around 5 to 10% of the total diabetes which occurs. Most common type is what we see generally is type 2 diabetes, which is caused by insulin resistance or the decreased action of the insulin which is required to be done, and that causes the insulin resistance syndrome and type 2 diabetes. This occurs around 90% of the people of generally patients we see in the OPD.
Diabetes is just one disease is actually a myth, which means. So in reality, diabetes is more like an umbrella. Different causes, different mechanisms, different treatments.
Yes.
And this is why, self-diagnosis or copying someone else's treatment can be really dangerous.
Yes, definitely. Genetic predisposition is the main cause because we have some chromosomes and genes which are protective for type 1 diabetes, and some are giving more prone for the type 1 diabetes, but not very hereditary as we call it, where it runs in the families. There is very less chance of running in the families, but we have some syndromes what we call as where all the kids of one family can have type 1 diabetes.
Wow.
And the complications of uncontrolled diabetes, as we all know, chances are more in type 1 diabetics, like microvascular disease, kidney disease, retinal disease is more in this type 1 diabetic patients.
Many people don't realize type 1 is an autoimmune condition. It is not related to lifestyle. Like typically diabetes is known as a lifestyle disease, but type 1 diabetes is actually, it has got nothing to do with life. So why it is important for patients to know which type of diabetes they have?
The diagnosis or type of the diabetes which is diagnosed by the doctor determines the therapy for the patient.
There is something called as 1.5, which is also LADA, as latent autoimmune diabetes in adults.
The name suggests 1.5 means it is in between type 1 diabetes and type 2 diabetes.
During COVID times, I think steroid was prescribed. It was highly used. Post-COVID, could you find any more changes?
COVID itself can cause diabetes in many people.
Okay.
The stress of that whole pandemic caused diabetes to many people.
We are adding for the first time a very fun element in this. The doctor behind the white coat, personally, honestly, and with a lot of fun.
As a clinician and as a person, to make the patient care possible is also 50% important as patient care.
Wow, that's a very important perspective, I think.
Every doctor says that his own practice should getting developed, and some newer developments should happen in his field by him, his clinic, and he should do something for the society also in a bigger way.
Right.
So
anything futuristic, be the first mover.
Yes.
Okay. What is that one thing you love most about being a doctor?
The most good thing, the best thing which we all doctors like is respect.
Hello everyone, and welcome to another insightful episode of Azkka Virtue Podcast. Imagine this: a person feels completely normal, going to work, eating regular food, living a normal life, and one day a routine blood test shows diabetes. Today, this is not rare, this is a reality. India today is home to millions living with diabetes, and many don't even know what type they have or what it really means. As the famous saying goes, the biggest risk is the risk you don't know that you have it. And to guide us through this important conversation, we are joined by a very experienced diabetologist who has been actively managing diabetes and metabolic disorders, Dr. Prashant Kulkarni from Bid, Maharashtra. He leads Arnav Hospital and Diabetes Care Center in Bid, which has become a recognized center for comprehensive diabetes management. Sir, it is such a pleasure to have you for this conversation, and it is
Yes.
indeed, we are so happy to have you.
Thank you. Thank you for the welcome.
And sir, I understand it has been a long day for you, a long journey. So, uh, my heartiest welcome to this Azkka Virtue podcast.
Thank you.
सो सर आई विल डाइव इन राइट इनटू द फर्स्ट क्वेश्चंस
Yes.
सर एकदम बेसिक से मैं पूछना स्टार्ट करूंगा बिकॉज डायबिटीज़ आज एक ऐसा कंडीशन है जो इसका क्लैरिटी अभी भी काफ़ी लोगों के पास नहीं.
Correct.
देयर आर पीपल हु ओनली बिलीव दैट डायबिटीज़ मीन्स हाई शुगर.
Yes.
So because many people don't fully understand what diabetes really is, if you can throw some light on what exactly is that, how it is diagnosed, and how common it is today.
Yes, that is the basic thing everybody should know in India, because as we know, India is the diabetes capital of the world.
Right.
At present, we can have around 10 to 11 crores of Indians who are having diabetes.
Wow.
And around 4 to 5 crore of people are having pre-diabetes, which they have not checked, and they don't know also that they have pre-diabetes.
Wow.
So everybody should know about diabetes, because it's not a physical or mental illness, but it is giving socio-economic burden on themselves and the country itself. So diabetes is a group of disorder which we can call as it makes changes in the glucose metabolism throughout the life, and the patient can have increase in the blood glucose level to some extent due to many various causes, as we can say, and that glucose level to be checked at certain intervals will give us the diagnosis of diabetes. As we know, the diabetes can be diagnosed by checking blood glucose levels, fasting blood glucose level. It comes more than 126 milligram per deciliter. It is called as diabetes. Then when postprandial or blood glucose level after oral glucose load of 75 gram in 1 glass of water, after 2 hours it should be more than 200 to call it as a diabetes. And another test we do generally is HbA1c. If it is more than 6.5%, we call it as a diabetes. And another entity is there called as pre-diabetes, or we can say in between indeterminate results of the blood glucose levels or HbA1c. So if fasting blood glucose level is between 100 to 125 milligram percent, we call this IFG, or impaired fasting glucose. Then if oral glucose tolerance test is between 140 to 199 milligram per deciliter, we call it as IGT, or impaired glucose tolerance. And if HbA1c level falls in between 5.8% to 6.4%, we call it as a pre-diabetes. So pre-diabetes is a condition that many people are there in India, and it is a condition where we can reverse diabetes. That is to be focused by every person and the clinician.
So sir, as you said that in this group of pre-diabetes, there is a huge population which is there, but somehow because of not getting any particular symptoms, or it has still not aggravated to that extent that it will manifest into symptoms.
Yes.
It is not getting screened also, and
Yes.
it's a time bomb, which
we
is about to blast in say maybe few years.
Anytime. Okay.
Oh, but data is indeed very very scary, I would say.
Yes. Yes.
So this is actually very important, because most people also think डायबिटीज सडनली चालू हो जाता है,
हाँ.
बट ऐसा है नहीं. सो मेडिकली it is developed silently over the years, and diabetes doesn't just start in the reports, it starts in the habits. So I
habits.
think everything boils down and needs to be taken care of.
Yes.
So, sir, another big confusion is people think diabetes is just one disease. So, what is the latest classification or types of diabetes people should know today?
Yes. Different authorities like American Diabetes Association, our own Indian Research Society for the Study of Diabetes in India, that is RSSTI, have done very thoroughly studies on thousands and lakhs of people, and they have given us a good classification or types of diabetes. Generally, we call it as a four. There are four different types or classification of diabetes. Number one is type 1 diabetes, which generally occurs in children or adolescents or age less than 35 years. It is around 5 to 10% of the total diabetes which occurs.
Right.
It is caused by autoimmune reaction to the beta cells of pancreas, which causes their destruction, and the patient has to take insulin for existence and survival
Okay.
for the whole life also.
Okay.
Then second most common type is what we see generally is type 2 diabetes, which is caused by insulin resistance or the decreased action of the insulin which is required to be done, and that causes the insulin resistance syndrome and type 2 diabetes. This occurs around 90% of the people
Okay.
of generally patients we see in the OPD. Then other specific types of diabetes are there. We are very less in number, but still they have to be kept in mind by the clinician to treat them. And fourth, another growing diabetes is gestational diabetes, that is
Right.
pregnancy induced diabetes mellitus,
Right.
which occurs around 5 to 10% of the type 2 diabetes.
Okay.
So as obesity and other parameters are increasing, the pregnancy related diabetes also is getting growing day by day, we can say. So it has to be also taken care, because that is the we can see, we have to see for the two lives as a
Absolutely.
gestational lady and the fetus.
Okay. So this also makes me curious to ask you, since you just mentioned about gestational diabetes, and which is also very less talked about. So gestational diabetes is diabetes which is detected during pregnancy.
During pregnancy.
So just out of curiosity, that once the baby is delivered, will it just go away, or it stays?
There are chances that 30% around the diabetes will continue, and
Wow.
70% of the times, by the theory we can say, the diabetes can go away if it is a type 2 diabetes, which is was previously also occurred in the previous pregnancy, or the patient is obese or slightly overweight, we can say, and the patient does not have any strong family history of diabetes itself. So there are both the chances, we can say.
And what about the baby?
Baby can have some different problems. Very less chances of getting diabetes immediately after birth.
Okay.
But the intrauterine malnutrition, which can occur during diabetes, that can turn the baby into a diabetic person after a few years, or we can say earlier in the life. So that is another risk factor for the gestational diabetes.
Right. So I think this also clears a lot of things in and around diabetes, because I think most of the viewers only feel that diabetes is high sugar, but these types exist, and I'm
Exists,
sure
yeah.
that every category is so different and needs to be treated so differently by the clinicians. They have to understand the entire thing, and then maybe conclude and give the
Treat the patient.
therapy
Yes,
accordingly.
yes, yes.
So that diabetes is just one disease is actually a myth, which means, so
Definitely.
in reality diabetes is more like an umbrella, different causes, different mechanisms, different treatments.
Yes.
And this is why self-diagnosis or copying someone else's treatment can be really
Yes, yes,
dangerous,
definitely.
because we also come across people who talk very casually about it, that I take this, you also start taking it, and I
Yes.
think without understanding and going to the expert, it can turn
That
out to
can
be
be
indeed
definitely
very very
dangerous.
dangerous. So, sir, let's talk about type 1 diabetes. What actually happens inside the body in type 1 diabetes?
So type 1 diabetes is generally we call as a diabetes which occurs in the very early age or children, or we can call is less than 35 years.
Okay.
So that is most commonly an autoimmune process where our body itself damages our body. Autoimmune we can call
Right.
it. So some antibodies are generated in the body due to some environmental factors or genetic factors, and those destroy our beta cells of pancreas, and that causes nearly total destruction of the beta cells of pancreas.
Okay.
So no insulin or very less insulin secreted by beta cells, and that causes the symptoms may be very severe. The patient may land at the time of diagnosis only in, we call it as a diabetic ketoacidosis. Means whenever the glucose are too high, more than 350 milligram or more than that, and the patient gets very high amount of dehydration, which causes acids to be released in the blood, and that causes a serious life threatening uh, condition which has to be urgently treated in any ICU.
Oh.
So this can be the presentation of type 1 diabetes. As I said, there are many types of autoantibodies which we can detect in the blood, like GAD65 antibodies, insulin antibodies, then anti-islet antigen antibodies, or zinc transporter antibodies. These are the antibodies we can detect in blood to diagnose type 1 diabetes.
Right.
90% of the times, more than two antibodies are present. But 10% or less than that, there are no antibodies, but the patient still having diabetic ketoacidosis, or in slightly lesser incidence, we can say the patient or small child can have failure to weight gain. Patient is not playing playful as he was or she was
Right.
earlier. Then they have the classical symptoms of diabetes we call as 3 Ps: polyuria, polydipsia, and polyphasia. Means
Okay.
more urination, more thirst, and more feed or more hunger the
Acha.
patient will have suddenly.
Okay.
So after that, investigations can be done when we do the investigations like fasting, post-meal HbA1c, autoantibodies, and the progress of the patient declares that he has or she has type 1 diabetes, and where he has to be on insulin for the whole life also.
Okay.
So this is autoimmune destruction, which causes type 1 diabetes, and it's around 5 to 10% of the total diabetes which we get.
Oh.
And nowadays it's increasing.
Okay. So, sir, this also makes me curious that is there any particular age group where this manifestation of symptoms you see higher?
Yes, generally we can say the adolescent age group, and very small, like 5 to 6 years people, kids, and adolescent like 10 to 15 years are more prone for this due to
Okay.
growing hormones and changes. They can be more susceptible for this.
Okay. And sir, is it genetic? Genes has a
Genetic,
role?
yes, genetic predisposition is a main cause because we
Acha.
have some chromosomes and genes which are protective for type 1 diabetes, and some are giving more prone for the type 1 diabetes, but not very hereditary as we call it, where
Right.
it runs in the families. There is very less chance of running in the families, but we have some syndromes, what we call as, where all the kids of one family can have type 1 diabetes.
Wow. Okay.
1, 2, 3 at some age. All the diabetes specialists can have such families who have all 1, 2, 3 kids having type 1 diabetes and all are on insulin.
Wow.
So this can be the genetic predisposition, not
Right.
hereditary as we call it.
So, do we understand that insulin is the only thing available for managing this?
Yes. Insulin is the
Gold
need
standard.
for the patient.
Ah, so
Need.
it's a
Any type of
necessity.
insulin we can give, but that is a need, because without that the patient cannot survive, and he will go in ketoacidosis immediately after 1 or 2 doses missed.
तो सर आपको सुन के अभी मुझे ये भी लग रहा है कि इतना तो कितना ज़्यादा अनअवेयरनेस भी होगा इन द सोसाइटी.
Yes.
आई थिंक मोर इन द रूरल एरियाज एंड ऑल. सो वहाँ पे फर्स्ट ऑफ ऑल आइडेंटिफाई होना, रीचिंग टू द राइट एक्सपर्ट एंड देन ensuring मैनेजमेंट. I think there is
Very
still a
difficult.
long way to go. I'm
Yes,
sure
yes.
awareness is increasing day by day, but it is
There
still,
are,
I'm sure.
yes, there are many problems also. Some poor families don't have continuous flow of money for the insulin
Right.
also. So there is a big problem also. Sometimes they miss the insulin and they land in decay. So they have to get admitted and again they have to spend money.
Wow.
And the complications of uncontrolled diabetes, as we all know, are chances are more in type 1 diabetics,
Right.
like microvascular disease, kidney disease, retinal disease, is more in this type 1 diabetic patients.
Okay, okay. So this is actually very important to know, that because many people don't realize type 1 is an autoimmune condition. It is not related to lifestyle. Like
Yes,
typically
yes,
diabetes
yes.
is known as a lifestyle disease, but
Yes.
type 1 diabetes is actually, it has got nothing to do with lifestyle. And this is why awareness is very important, especially for parents and young adults. And I think as a part of school curriculum also, this is something which has to be a
Has to
part,
be taught.
because early diagnosis can prevent, emergency
Yes,
situation. And
I can tell you one thing, that there are some studies also in foreign countries that they have prevented some type of type 1 diabetes by,
oh,
yes, early screening of the family members. As I said, if elder kid is having type 1 diabetes, the another kid will be screened every 3 monthly, 6 monthly, and it can be prevented to such a some extent at least, that he will
right,
be having less doses of insulin, less complications.
right. So I have heard also somewhere that type 1 diabetes is also called as juvenile diabetes. Why is type 1 diabetes no longer called as a juvenile diabetes now?
Yes, we can say that previously it was said juvenile means less than 18 years of age, and mostly type 1 diabetes occurs in that age only, adolescent or early age. But nowadays we are seeing the obesity is increasing. Then the kids of 10 years are having very obese physique,
Right.
and they are having central obesity, triglycerides increased,
Wow.
and pre-diabetic and diabetic kids also are there.
Oh.
So type 2 diabetes also can combine in early age nowadays due to
Okay.
industrialization, whatever we say,
So as early as
as
adolescence?
early as 10 years we can say.
Oh,
So
wow.
there are studies where 10 years is the age found for the type 2 diabetes.
Oh,
So it is very difficult to differentiate in those diabetes type at that age. First thing. Second thing, we can say type 1 diabetes also sometimes gets delayed. So it can occur after 25 years, 30 years also, due to this autoimmune progression will be many times slower than uh, other patients. So that can happen after 25 years also. So there is a mixed pattern we can see. So no
okay.
longer we call juvenile as type 1 or
Ah,
adult as type 2. We
right.
have to, as the age of the patient, clinical presentation of the patient, diagnostic lab values of the patient, and response to treatment. That will decide the pattern.
Okay. So usually, if kids as young as 10-year-old comes to you, usually they come with what sort of symptoms?
At present, we can see type 1 diabetes is more, but some kids of 10 years, I can't say, but 15, 16 years are coming to my clinic also,
Wow.
who are having type 2 diabetes.
Okay.
Typical what we call metabolic syndrome. They will have obesity, raised triglyceride, diabetic levels of blood sugars, acanthosis, we call as acanthosis nigricans. Uh, Girls can have PCOD and early menarche. These all things are coming. So that has to be, we do generally auto antibodies levels. If they are lower side, then we can try on metformin and other drugs. So we can clinically judge the patient and
Right.
then decide the treatment.
वाह. सो सर अभी तो मतलब कह ही नहीं सकता, क्योंकि व्हेन वी वर ग्रोइंग अप, एल्डर्स ऑलवेज यूज्ड टू से कि आपकी एज में तो कुछ भी खा सकते
खा
हो, कुछ
सकते
भी
हैं,
कर सकते हो. आई थिंक
नहीं
नो
है अभी,
मोर.
नहीं है अभी,
अभी
ऐसा
नहीं
नहीं
कर
है.
सकते. वाह, दिस इज स्कैरी. This is very important, update for public awareness, I would say, because earlier people thought type 1 diabetes happens only in children, but today medicine is also teaching us that diseases are changing patterns,
Yes.
setting in much earlier. I mean, for an adolescent, 15-year-old, nobody would have even thought, maybe say 10, 15 years before, that it would be
It-
so common. And so I think the data is indeed very scary, and that's why it is more important to be aware
Yes.
as parents, as caregivers, as siblings. So anybody who has, elder siblings or young children in home, I think this conversation, what you are saying, will be very, very important. Sir, why it is important for patients to know which type of diabetes they have?
Yes, the thing which I said, that the diagnosis or type of the diabetes which is diagnosed by the doctor determines the therapy for the patient. Means if he is type 1 diabetes, he will be on insulin. Type 2 diabetes, he will be on the therapeutic lifestyle changes along with some medicines. And this is a long process, chronic process. So first he has to be diagnosed, and it has to be clear to the patient, relatives, and the clinician. So that the chronic process should be as a routine, be mastered as a self-care by
Right.
the patient and relatives, and it is easy to monitor by the doctor to prevent the illnesses complications. So diagnosis, sometimes we can diagnose in first visit due to
Right.
clinical presentation and lab values. But sometimes we need, as I said, type 1, type 2 can occur in any ages sometimes. So we need genetic studies or some different studies, USG, MRI. Then after a follow-up visits, 1 or 2, 3, we can get the diagnosis.
Oh.
So diagnosis and typing of diabetes is very important for the total process the patient has to follow.
So, sir, through this, I can also imagine, okay, for a doctor, it is not about just reading reports and prescribing a therapy. It is
Nothing.
about looking at so many angles, right, from the history to even counseling, I would say. I think counseling must
Counseling
be
is,
taking a lot of time,
yes,
क्योंकि
yes,
आज
yes,
acceptance होना कि मुझे diabetes
yes.
है itself is
It's
a
very difficult for
challenge.
everyone, and for the child and its relative, it is
Even more
very difficult,
difficult.
very difficult.
Very true. So I think it's not a simple job. I think it's a very complex thing where you need to look at holistically to treat the patient also, and at the same time make sure that they are at a better space of mind, because
Yes,
since it
yes,
is already
yes.
diagnosed. So wow. So we have also been hearing, apart from type 1 diabetes or gestational diabetes or type 2 diabetes, there is something called as 1.5,
5 is
which is also LADA, as latent
LEDA.
autoimmune
Yes,
diabetes
yes.
in adults.
Adults.
So, sir, can you throw some light? Because
Yes.
we are creating awareness only in terms of the different types commonly known, but I think in last few
Uncommon
years
types of.
this has also come up. So I think
Yes,
it will be
yes,
very
yes.
interesting for all the
Yes,
viewers.
as the name suggests, 1.5 means it is in between type 1 diabetes and type 2 diabetes.
Okay.
As we think type 1 diabetes is autoimmune process, occurs in early age. And type 2 diabetes is not at all autoimmune process, is a lifestyle disease caused by insulin resistance and the physical inactivity and it's a calorie surplus.
Right.
So in between, some patients are there who are presenting as they are not at all obese, but still they are presenting with diabetes, and generally after 35 years of age, like
Oh,
type 2 diabetes.
okay.
But in a few days of therapeutic lifestyle changes or some oral medications, they will not control the blood sugar levels, and they
Acha.
will end up into insulin, starting the insulin.
Oh.
So this is called as a late onset diabetes in adult, autoimmune. So autoimmunity slowly progresses and
Okay.
destructs the beta cells, so that the
Acha.
patient will not be having obesity. He will not be having this severe symptoms like diabetic ketoacidosis. But still, after a few years, 1 or 2 years, after 35 years of age, he will land in insulin.
Oh.
So slow onset type 1 diabetes, we can call it is.
Okay.
So only benefit is he is not presenting in early age, and the complication rate as late presentation and insulin requirement is further prolonged, so the complication rate will be slightly lower than type 1 diabetes.
Okay.
And it's taken as type 2 diabetes also
Right,
because its
absolutely.
presentation is late.
Right.
But still, after therapeutic lifestyle changes, it will early 1 or 2 years, he will not tolerate all the medicines and he cannot control his blood glucose.
Okay.
So he has to go on insulin.
Wow. Sir, how common is it?
We can say less than 5%.
Okay.
But still, some people who are having some other malnutrition factors or who are family history of lean type 2, type 1 or type 2 diabetic patients, they can have still the LEDA in means more frequently.
Okay. So this is probably one of the most under-recognized forms of
Form of,
diabetes
yes,
which we
yes,
just discussed. And if mistaken for type 2, treatment delay can happen, which can affect long-term
long
outcomes.
term
So I
outcome.
think
Yes,
this is where role of an expert
yes,
absolutely
yes, yes.
comes in. Sir, what are other specific types of diabetes, caused due to genetics or maybe say pancreatic diseases or medications?
Yes, yes. There are many different types of which are rarely occurring or less occurring, we can see. Some main are monogenic diabetes syndromes, which are caused by the genetic problems in the on the chromosomes or in the beta cells, action of the beta cell, or causing insulin resistance. Generally, first is what we call as MODY, maturity onset diabetes in young, which occurs in young people less than 25 years, but generally occurs due to genetic changes in some expression of the chromosomes, we can say. There are many
Okay.
types also, so MODY 1, MODY 2, MODY 3. Every this suspecting MODY should be checked or diagnosed by genetic testing,
Oh.
which is done by very few labs in India. But whenever we suspect, they have a typical pattern of family history.
Okay.
Generally, many family members are involved.
Hmm.
They are started, means they have diabetes at early age. Each member can have, or some alternate family members. Family means father, then his son, but father is not diabetic, but son is diabetic, and his grandfather may have diabetes.
Right.
Alternate pattern,
Skip genes.
skip genes. There may be alternate changes or early diabetes in families runs. So there is one genetic testing which will show you that the even if the patient is having earlier age diabetes or type 1 like type 1, but the patient will not require insulin because of the genes changes are such that that can respond to some sulfonylurea like oral anti-diabetic drug.
Okay.
But there are other things also which can happen in these syndromes. They are not so good. So
Right.
earlier diagnosis will save from insulin. That is one thing. We can call it as a type 3A diabetes also due to genetic changes.
Okay.
Some genetic changes are such that they are causing insulin resistance. The insulin which is produced by those genetic changes is not so of quality. So it cannot work so good as a natural insulin. So
Okay.
type insulin resistance syndromes like they are genetic. We call it as a 3B diabetes.
Oh.
And pancreatic diabetes is there, we call it 3C diabetes.
Wow.
So pancreatic means any pancreatic injury, pancreas, pancreatitis, surgery, trauma, pancreatic cancer, or some congenital diseases like cystic fibrosis or other, which can cause that the beta cells of the pancreas also damaged, exocrine function of the pancreas is also damaged. So the patient will have exocrine deficiency, malnutrition, and diabetes itself. So this is another type we get in some young patients.
Okay.
Like pancreatitis we can have in alcoholic patients
Right.
or other any pancreatic disease. They might be having young patients with weight loss, malnutrition due to pancreatic insufficiency. So they have to be diagnosed by scans, some pancreatic tests, and autoantibodies. And generally, autoantibodies are negative in this case. So we can diagnose it as pancreatic diabetes.
Right. Right.
Then other types are
due to medication or something?
medications also. The common medications we are getting nowadays are steroids.
Ah,
That is a major cause causing insulin resistance, because
right.
steroid, it's a hormone which is antagonist to insulin.
Hmm.
It is causing hyperglycemia, insulin is causing hypoglycemia.
Hmm.
So that is one commonest drug we can say. Some HIV drugs are there,
Okay.
which are definitely causing both insulin resistance and decrease in the secretion. Some newer anti-cancer drugs like biologic agents, which are causing very much of insulin resistance and diabetes nowadays.
Right.
And other old drugs we can say thiazide diuretics, statins sometimes, and interferons, antipsychotic drugs, which can cause sometimes diabetes,
Trigger.
but more than when used in more the required dosage. That is the main thing. And we can have follow up every time doing blood sugars for these patients, so that we can prevent the diabetes or prevent the complications.
Right. So, sir, I'm also curious to ask that during COVID times, I think steroid was
Used.
prescribed. It
Yes,
was
yes.
highly used. Post COVID, could you find any
Yes,
more
yes, yes.
changes because
COVID
of steroid?
itself can caused diabetes in many
Ah,
people.
okay.
The stress of that whole pandemic caused diabetes to many people,
Right.
and steroids also caused
Hmm.
to many people. And
Right.
post COVID, the type 2 diabetes or COVID related diabetes also increased.
Hmm. So the field of dermatology usually, has a lot of skin treatments require
Steroids.
steroids.
Yes, yes.
So if applied locally, topically,
Yes.
it also
No, no. Local
triggers.
topical applications,
Does
very,
not.
very less chance.
Okay.
Only systemic absorption causing insulin resistance can do it.
Right. So they're having, being, uh, practicing for more than 2 decades now. I'm sure you have seen the entire journey and a sea change in terms of patient behavior, in terms of technology, in terms of way it was diagnosed, in terms of medicines.
Yes.
How do you see the future of the disease in terms of management?
Yes, nowadays means 20 years before, when we were residents, we have very less diabetic oral anti-diabetic drugs also, 3 or 4 drugs. Now the drug armamentarium is increased too much. We have insulins also very 1 or 2 types. Now we have 4 to 5 types of insulin. Then CGMS is there for monitoring. Then
Which is
insulin pumps,
continuous glucose
continuous
monitoring.
glucose monitoring. Then insulin pumps are there for who can afford at least
Right.
insulin delivery system.
Okay.
This has changed very much, and the monitoring system, the guidelines we are getting nowadays. These are also improving the complication rate. That is very good. And most now, as a complication of diabetes or precursor of diabetes, obesity and dyslipidemia, they are also treated well nowadays than the previous era.
Okay.
So though the prevalence is increasing, so we are being well prepared for the we can say उसके साथ लड़ाई में थोड़ा ज़्यादा तैयारी है.
Right.
So
Right.
that is a good thing. And we can say that some of the medicines nowadays we are listening, insulin inhalers are also coming. So mankind or some pharma has come with insulin inhaled. So that is first time in India, but after a few days we can get it.
Right.
And every type 1 diabetic who needs insulin can also afford it, I think.
Wow.
So these
Right.
changes have made something good for the patients, I think.
Right. Sir, how would you, uh, you know, look at patient behavior? Because I think today, in terms of Google self-diagnosis, everybody has become, feel that they are expert without visiting an
Yes,
expert.
this,
So,
this
in terms
is
of patient behavior, sir,
this is not at all a good thing. We can say they are total chaos in this field. We can say
right.
anybody can Google the symptoms, Google the tests, Google the reports, and drugs also. And
Right.
whatever drug we write, they say there are so many complications, side effects of these drugs, so we do not want to take this. And nobody wants to give attention to the main thing: exercise, diet, lifestyle modification. So this is also a problem, big problem every clinician is facing.
Wow.
And young people who are socially active or active on social media and other things, they will have definitely a problem.
Right.
Older people are listening to the doctor carefully and following also.
So I think this is a very important message that some things has to be left to the expert. I
Yes.
mean, end of the day, you are visiting a diabetologist who has studied for say more than a decade,
Yes,
and then he is sitting at a level and you are coming to consult. So I think nothing that 10 years of studies cannot be replaced by one WhatsApp forward or maybe
definitely,
say one Google search, I would say.
definitely.
Right. So, sir, as we come towards the end of this wonderful conversation, where a lot of things got cleared, and we are also happy to bring this on this forum because understanding diabetes basics from somebody who is authentic, who has been practicing for
Yes,
20
yes,
years,
yes.
makes a lot more sense. We would also love to know the person behind the white coat. So, can you share something about the journey, your roots, and the childhood that shaped you what you are today?
Definitely. Uh, I had not thought that I will be a doctor or anything,
No.
but as normally good in routine studies, so my parents thought that I should be a good white collar person, either doctor or engineer, so they preferred to become a doctor. And
Right.
during MBBS days only, I was having like towards internal medicine only,
Okay.
not the other surgical branches or other
Hmm.
branches. And because I saw many senior clinicians and
Hmm.
physicians who are seeing n number of patients daily
Hmm.
and giving them some education along with the treatment to for the wellness and preventing their illnesses, their socioeconomic burdens,
Hmm.
and feeling happy at the end of the day.
Hmm.
And with that, what I thought at that time was this branches of consulting like diabetology, cardiology, and
Hmm.
other can give you yourself also the education that you should have work-life balance.
So true.
You should also exercise time, get time to exercise, to
True.
sleep, for your things. So
Right.
that has attracted me for this interest in diabetes, and it's further I started in diabetology only.
Wow. So I would thank your parents that end of the day we got such a good doctor
Oh,
who has been treating for 2 decades now and has treated thousands of patients. And I'm sure Arnav Diabetes Center is doing a fantastic job in the city of Bede, where you provide not only just a treatment but a comprehensive care,
comprehensive
uh,
diabetes care.
which is something is very very important in today's time. Okay, so sir, as we come towards the end of this fantastic conversation, uh, we are adding for the first time a very fun element in this.
Okay.
So let's discover the doctor behind the white coat, personally, honestly, and with a lot of fun. So, sir, I'll be asking you a few questions. Be very candid,
Okay.
because this is something, this side of yours, I'm sure not many would have seen. So, these questions are to bring out that side of a doctor, wherein typically very serious setup, everybody would have seen you.
Yes.
So, are you ready, sir? Okay.
Yes.
So, what is one hobby people would be surprised to know about you?
I generally like to watch cricket matches. I
Okay.
can watch test match also, one day
Right.
match also, and T20 also.
All 5 days following.
5 days also.
Wow. What is something small but that makes you very happy?
I think from outside the clinic you are asking.
Yeah, yeah.
Good food,
Okay. Great. Home cooked food more? Okay.
home cooked food.
Okay. What is something you believe every doctor should remember?
I think every doctor remembers first is care of the patient, the attitude of taking care of the patients,
Right.
And but I would suggest taking care of himself as a clinician and as a person to
Wow.
make the patient care possible is also 50% important as
Very true.
patient care.
Wow, that's a very important perspective, I think. What do you enjoy more, diagnosing cases or counseling patients?
Diagnosing a patient.
Okay. One dream you are still hoping to achieve someday.
I think, as every doctor says, that his own practice should getting developed and some newer developments should happen in his field by him, his clinic, and he should do something for the society also in a bigger way.
Right.
So that
So
is
anything
my dream.
futuristic, be the first mover.
Yes.
Okay. What is that one thing you love most about being a doctor?
The most good thing, the best thing which we all doctors like is respect.
Very true.
Whatever, whenever anybody says you are a doctor, you will be respected.
Wow.
So that is the most important thing.
Wow. That's fantastic. Thank you, sir. Thank you so
Okay,
much.
thank you.
Today, we learned something very important. Diabetes is not just a sugar disease, it is a lifestyle, metabolic, and awareness disease. As the famous saying goes, take care of your body, it is the only place you have to live. So, thank you once again, sir, so much for
Thank you. Thank you.
sharing your valuable knowledge, uh, your clinical insights, your experience with all of us. Don't forget to like, share, and subscribe Azkka Virtue podcast and share it with someone who might benefit from this knowledge. Until next time, this is Azkka Virtue podcast where awareness meets action. Thank you, sir. Thank you once again for sparing your valuable time and joining us.
Yes, thank you very much for calling me, and thanks for the patient awareness that you are doing.
Thank you, sir. Thank
Thank
you
you.
so much.
Thank you.